South Carolina, there are about 43 free clinics, almost one in every county. There is one in Horry County. They say if you've seen one free clinic, you've seen one free clinic, because all the models are a little bit different. As far as whether the need is definitely expanding, and I'll tell you what's disturbing to me is that the people, our new patients, because I do a study, we get overwhelmed with new patients sometimes. Our new patients are young. They're not old. They're not, and they're people that haven't, I say, they haven't launched yet. They're out of school. A lot of them have a college education. They're out of school. They're no longer eligible to be on their, they're past the age at which they're eligible to be on their parents' insurance. And you know, the good news is they're relatively healthy. They've got probably some infection or something going on, but that to me is very disturbing, that we're seeing so many younger people. The other group that we're seeing, and you can spot them in the waiting room, are people that always had a job, always had insurance, never thought they'd be in this situation. And maybe they lost their job 2 years ago, and they held on to their COBRA for 2 years, and they paid and paid. Now they've exhausted their life savings, they have nothing, and they've never been in the system before. And that's why the benefit bank has become so important, because these people don't know how to access the system. And they are truly, you can spot them in the waiting room, they are deer in the headlights. They never expected to be here. And that you think many times, there but for the grace of God. We could always do more if we had more. We could see more patients. We could do more with more. We have 134 volunteers. We're getting more every day. I'm to the point in that little building where I'm out of space. And yet the need keeps growing and the need keeps continuing. However, our board of directors has very wisely decided to take a watchful waiting attitude, because with healthcare reform in such jeopardy now, theoretically, when it was voted on, you know, when it was passed, theoretically in 2014, I would only have 1 or 2 patients in my waiting room. Everybody would qualify for Medicaid, because Medicaid is supposed to move for purposes of healthcare to be more income-based. So, to your question, that's supposed to happen in 2014. Starting to look a little doubtful. You know, it's going to be heard. The case is going to be heard by the Supreme Court shortly, and we'll wait to hear about that. I think if that wasn't on the horizon, we would be looking for a larger building. We would be looking for our space as our final frontier. We have a small part-time staff, 11 people, and we find that we need a bare minimum of staff. We have to pay a clinical director. We have to have some coordinators, paid people to coordinate all those volunteers. So we have a nurse coordinator, we have an office manager, that sort of thing. Our next biggest expense behind that is pharmacy. Even though all of our patients qualify for patient assistance and we use generics a lot, we find that we need to fill a lot of, our pharmacy is intended to be a bridge. People walk in and they have blood pressure at a point that you can't let them walk out of the clinic without something to take. You cannot take the chance that they will not get their medicine.
Yeah. Well, do you get any Medicaid reimbursement?
No. We don't see Medicaid patients. So, yeah, we're uninsured. We say uninsured.
Are you treating children?
Generally, no, because children do qualify for Medicaid. So we occasionally see some kids who have not been enrolled, and they come in and they're sick, and so we will see them and make sure that they get enrolled in Medicaid. We had a child today, and we only had one provider, and we needed to cut off, and the volunteer who's working the front desk comes to me with tears in her eyes because we had cut off at 10 patients, which is unusual, but we only have one provider. Tears in her eyes because a little girl, her mother brought her in, and she has a horrible ear infection, and she's crying because she hurts so bad, and so we saw her.